Hey, so Dr. Kathy here. Nice to see you. Yesterday we talked about the vital signs, right? The blood pressure, the pulse, the oxygen level, the temperature, and the blood sugar to see how it really affects your circulation, okay? Sexually, okay? So today I want to take them one by one and talk about them so that you'll understand how it impacts your sexual function. How those vital signs that you should be aware of and that you should really, really check with your doctor to make sure that you have great vital signs, right? Or check with yourself by getting those equipment, those tools, those devices that we showed you yesterday, right? And I really want you to be able to be in control of your vital signs, okay? Remember, blood pressure, woohoo, 120 over 80 and less. But today we're going to talk about the heart rate, okay? So remember this little pulse oximeter, right? You can buy it at the stores. And you can get your own measurement of your oxygen level at the top. It says O2, and then at the bottom here is your heart rate, all right? So we're talking about the heart rate today. Heart rate. What is the heart rate? The heart rate really is how many times your heart beats, ba-boom, 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 per minute. So the normal heart rate is between 60 to 100. If your heart rate is beating under 60, that's called a slow heart rate. If your heartbeat is beating above 100, that's called a fast heart rate. So typically we want it in between. There are many causes as to why it could be too slow, under 60, or too fast, over 100. So you always want to look into that, right? It could be your diet, right? Coffee will make your heart beat fast. It could be drugs, right? Street drugs, even prescription drugs can do it. So you got to find out what is making your heart rate beat too fast. Because if it beats too fast, that means the heart is going boom, 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 and not enough blood is going to the groin because we want to get blood into that genital area, which means the clitoris, the penis, the uterus, the ovaries. Okay? We want to get it into those organs so that they can be fed food, nutrients to function optimally. Without that nutrition, that heart rate pumping, you're not going to be able to get blood into those organs for you to function properly. So remember, the heart rate has to be between 60 and 100, not too fast. If it's too fast, it's going to be just pumping like that and it's going to be futile. It's like it can't get enough blood to go straight into the organs. And if it's too low, the heart rate's going to be pumping so slowly and weakly, right? Boom, boom, and not enough pressure, not enough power, not enough blood is going to go into the penis, and then it's going to be weak. Okay, and that's where you're going to get impotence, right? For the guys. For the women, you're going to have a hard time in terms of sensitivity, in terms of getting that climax, getting that orgasm. And the guys, you can't even get an orgasm, you can't even get an erection because the blood flow is so weak and it just goes flat, flaccid. That's when the heart rate is slow. So if your heart rate is slow, you want to make sure that you address it. If your heart rate is fast, you want to make sure that you address it because either way, you're going to get a problem in terms of getting blood flow into the organs for both men and women. So when it's too slow, it can also be medications, right? It could be drugs, supplements, diet, disease. There are several diseases that can make your heart rate very slow. And most commonly, it's the heart. We're going to start with the heart, looking at the heart that makes it too fast and makes it too slow. So your heart is the central function, central piece here that we need to look at to make sure your heart rate is normal. And we'll do an EKG, we'll do some tests in the office, and then if we can't find it, we'll send you to a cardiologist or to a vascular surgeon, depending on where the problem's coming from. But we will examine you. We will listen to the heart rate with a stethoscope, and we'll get your pulse. Now, the pulse can be obtained from many regions, right? The neck, the wrist, the groin, behind the knees, the foot, at the top of the foot, and even the brachial. We can get those pulses, and you want to feel it and know that it's pumping very well in terms of the strength and the um, amount of pressure we can feel when we're actually feeling your pulse, okay? So you can feel your pulse also here. If you're interested, we can also um, get an idea of how strong it is. And I do get sometimes that weak 30 pulse, which tells me, uh-oh, something's going on, right? So you need to also go to your doctor to get that evaluated if you find that it's very weak or it's hard to hear when you're doing blood pressure. Again, these are things that you'll find out from the doctor's office, but you need to just pick up one of these pulse ox machines, or on your blood pressure kit, you'll find that it does have a heart rate there. So remember, if it's between 60 and 100, you're cool. You're getting blood flow appropriately to the areas of the groin. But if you're not between 60 and 100, you're going to have some problems. Okay, so nip it in the bud, address it early so that it doesn't get worse. Okay. Another thing I want to point out is anxiety. Okay, so when we're anxious, men especially, your heart rate goes fast, right? Sometimes when you're depressed or fatigued or sick, it'll go slow. But I want to talk about anxiety because I see it a lot in my practice. There are a lot of guys that get anxious, and even women. And once you get anxious, your heart rate will go up. And again, we're going to have that ineffective pumping, and you're not going to get blood flow to the penis. Okay. So anxiety has to be addressed. Okay. Guys, gals, you've got to look at whether you're anxious. And you're going to be so surprised at the definition of anxiety. Anxiety is so common, we have no clue how to even identify it. It is so common, we just take it for natural that we're all anxious, right? And the truth is, we really are. We have episodes of anxiety, we have disorders of anxiety, we have situational anxiety, we have panic attacks. Oh my word. Can you imagine all the different types of anxiety that we have and experience for several reasons? Lack of sleep, stress, exams, so many different reasons. And now, obviously, some people function fine under anxiety, but some people will not. For those that do not, check your pulse, see whether it's strong, see whether it's too fast, see whether it's too slow, and get it addressed if you want to have optimal sexual function, which means you want to have that great orgasm, okay? So, anxiety will knock out your sexual function, guys, okay? So, if you're anxious, you cannot get an erection. Women, same thing. You cannot get an orgasm if you're anxious. So, how do you get more calm? Again, there's diet, exercise, supplements, natural supplements, herbs, vitamins, prescriptions for my guys. I love my Cialis and Viagra. Great for the heart. Opens up blood flow to the heart, right? And therefore to the groin. Love my Viagra, Cialis, and Levitra. All of you guys are great. And you can get it really cheap now from the compounding pharmacy, even from the regular pharmacies now. You can get it because the patent has run out. So please talk to your doctor about getting some Viagra, Cialis, Levitra. Any one of them will do, and improve circulation to your groin, guys, so that you'll get really hard and be able to function properly in the bedroom. Okay, women want you really hard. We don't want you going soft. And stop blaming us if you do. Get checked first before you blame anybody else. Okay. For the gals, it can affect your orgasm. You can have a little bit of an orgasm or a massive orgasm depending on blood flow. So you need blood flow to perfuse, to feed the tissues of the clitoris. And I'm saying the whole clitoris. Remember, go back and check the episode where I talked about the clitoris and how it has to engorge in order for you to have sexual pleasure. Okay. So the key is if you're having sexual issues, look at your heart rate plus other vitals, but right now your heart rate, see that it's not between 60 and 100, not above or below 60 or 100. If it is, please let's find out. Let's do some testing. Let's do some investigating. Send you to the cardiologist if we can't see the obvious reason. We'll get you to see a vascular surgeon if that's an issue. We'll look at the whole, blood work. We'll do some um, testing that will include like a heart check. But the reality is that you need to focus on what you can do at home, which is picking up a pulse ox. Everyone should have one, and a blood pressure monitor to measure your blood pressure. Remember, 120/80 and less. And your heart rate can be obtained on that same blood pressure monitor, and you can get the same thing from this pulse oximeter, or you just take your fingers, if you know how to do it, feel the pulse here. I can feel my pulse here, and again in the other areas, but most commonly the wrist, okay? Um, and whenever you get the evaluation done and the testing done, get it treated so the heart rate comes down into the normal range or comes up into the normal range. And cough, remember, is another thing that makes your heart rate go up that can affect the heart because it can wear out the heart. Okay, so please try and get that information on yourself, and let's see whether we can maximize your sexual function in the bedroom to have that big O. Okay, guys? Nice seeing you. See you next time. Ciao. Bye.